There is a small movement that becomes strangely difficult for many adults after 60. The hand reaches for a coffee mug, but the first two knuckles feel stiff. A jar lid requires both hands. The knees ache when rising from a chair, and the hips take several steps before they begin moving normally. The explanation seems obvious. Arthritis? Perhaps the cartilage is worn down. Perhaps this is simply what happens after decades of working, walking, lifting, and using the same joints every day. A bottle of Tylenol appears beside the bed. Advil or Aleve is taken when the pain becomes harder to ignore. The person adjusts the way they grip objects, shortens walks, and learns to live around the stiffness. Then other changes begin appearing. Energy disappears before the afternoon. The skin looks slightly darker even though there has been little sun. Blood sugar begins rising. The upper right side of the abdomen occasionally feels uncomfortable. A routine blood test shows abnormal liver enzymes, but the joint pain remains filed under aging. What almost nobody realizes is that certain diseases can damage the liver and the joints at the same time. In some cases, the joint pain appears years before jaundice, abdominal swelling, or other signs most people associate with liver failure. The hidden condition is not ordinary arthritis caused by aging. It may be iron overload from hereditary hemochromatosis. Hemochromatosis is a disorder in which the body absorbs more iron than it needs. Because the body has no simple way to remove large amounts of excess iron, it gradually accumulates in tissues. The liver is one of the main organs affected, but the iron can also damage the joints, pancreas, heart, endocrine glands, and other parts of the body. Joint pain, particularly in the hands and knees, can be one of its early symptoms, but this warning needs precision. Most joint pain after 60 is not caused by the liver. Osteoarthritis, tendon problems, bursitis, gout, rheumatoid arthritis, injuries, medication effects, and many other conditions remain far more common explanations. The liver itself is not sending pain directly into every aching knee or finger. The important idea is that joint pain and liver damage may occasionally be two visible effects of the same hidden disease. There are three patterns worth separating. The first is the ordinary mechanical pattern. Pain becomes worse after repeated use or weight bearing. The knees hurt after a long walk. The base of the thumb aches after opening jars. Stiffness may be present after rest but loosens after the body begins moving. One joint may be worse because of an old injury or years of uneven strain. That pattern is often consistent with osteoarthritis, although symptoms and examination are still needed before a diagnosis is made. The second is the inflammatory pattern. Joints feel warm, swollen, tender, and stiff for a prolonged period after waking. Several joints may be affected symmetrically. The fingers become puffy, rings stop fitting, and fatigue or fever may appear beside the pain. That pattern can occur with rheumatoid arthritis, crystal arthritis, infection, and other inflammatory conditions. It may also appear with autoimmune diseases that involve the liver. Autoimmune hepatitis, for example, occurs when the immune system attacks liver tissue. And recognized symptoms include fatigue, joint pain, nausea, poor appetite, discomfort over the liver, dark urine, pale stools, and jaundice. Many people initially have few or no obvious liver symptoms. The third is the systemic liver and joint pattern. The pain appears beside clues that do not fit comfortably inside an ordinary arthritis diagnosis. The knuckles ache, but the person also has unexplained fatigue. The knees feel stiff, but blood sugar has begun rising without a clear reason. The hands hurt, but the skin has taken on a gray, metallic, or bronze tone. The joints are blamed on age, while liver enzymes, iron studies, or family history quiet. Early point somewhere else. That is the pattern in which hemochromatosis becomes important. Iron is essential. The body needs it to produce hemoglobin, support muscles, and carry oxygen. The danger begins when the intestine absorbs too much over many years. In the most common hereditary form, changes in the HFE gene disrupt the body's regulation of iron absorption. The excess does not remain harmlessly inside the blood. It is stored in organs and tissues, where it can promote injury and scarring. The liver may gradually accumulate iron until inflammation and fibrosis develop. If the process continues untreated, some people develop cirrhosis, liver failure, or liver cancer. The pancreas may be damaged, contributing to diabetes. Iron deposited in the heart may contribute to abnormal rhythms or heart failure. The joints may develop chronic pain and structural damage. The joints provide a particularly deceptive warning because the pain may resemble ordinary osteoarthritis. A person may experience stiffness and aching in the finger joints, especially around the knuckles, along with pain in the knees, hips, or other joints. Once joint damage becomes established, lowering the iron may prevent further organ injury without completely reversing the arthritis. That is one reason early recognition matters. I want to tell you about a man I will call Richard, a representative composite rather than one identifiable patient. Richard was 66 and had worked for more than 30 years repairing heating systems. His hands had spent decades gripping tools, turning valves, carrying equipment, and working in cold spaces. When the knuckles of his index and middle fingers began aching, he was not surprised. He assumed his occupation had finally caught up with him. The stiffness was most noticeable in the morning. Richard had difficulty forming a tight fist for the first 20 minutes after waking. By breakfast, the fingers moved more easily, although gripping a wrench or opening a jar remained uncomfortable. He bought a large bottle of ibuprofen and took it on the days he planned to work around the house. The pain became manageable. That felt like a solution. Several months later, Richard noticed that his knees had begun aching as well. He stopped taking long walks with his wife and blamed the change on being out of shape. Then his energy began falling. Richard had always been the person who woke early and completed several tasks before lunch. Now he sat down after breakfast and struggled to begin the day. His doctor checked his thyroid and blood count, but nothing obvious explained the fatigue. A routine chemistry panel showed mildly elevated liver enzymes. Richard drank alcohol only occasionally, so he was surprised. An ultrasound later showed fat in the liver, and the abnormal enzymes were initially attributed to metabolic fatty liver disease because Richard was overweight and his blood sugar had entered the pre-diabetes range. That explanation was plausible, but it was incomplete. The following year, Richard's skin looked darker. Friends asked whether he had been spending more time outdoors. He had not. His blood glucose continued rising, and his finger pain became severe enough that he was referred to a rheumatologist. The rheumatologist did not look only at the painful joints. She asked when the pain had started, which knuckles were involved, whether the joints swelled, and whether any relatives had experienced unexplained liver disease, diabetes, heart problems, or severe arthritis. Richard remembered that his father had died with cirrhosis even though he had not been considered a heavy drinker. An older brother had developed diabetes in his 50s. A paternal uncle had suffered heart failure. Until that appointment, the family history had looked like several unrelated illnesses. Now it formed a pattern. The rheumatologist reviewed Richard's liver tests and requested iron studies, two of the most important initial measurements in suspected iron overload are transferrin saturation, which reflects how much of the blood's iron transport protein is carrying iron, and ferritin, a protein associated with iron storage. A high transferrin saturation can suggest hemochromatosis. While ferritin helps assess stored iron and the possible burden of disease, ferritin can also rise from inflammation, infection, alcohol use, metabolic liver disease, and other causes. So one elevated result does not establish the diagnosis by itself. Richard's transferrin saturation and ferritin were elevated. Genetic testing found 2 copies of the HFEC2A2Y mutation, a result that, together with the iron studies and clinical picture, supported primary hereditary hemochromatosis. NIDDK notes that finding 2 copies of this mutation confirms the common primary form in the appropriate diagnostic setting. The diagnosis changed the meaning of Richard's symptoms. His knuckles were not aching because the liver was radiating pain into his hands. The excess iron was affecting both places. His rising blood sugar was not necessarily a separate accident. His unusual skin tone was not a tan. His father's cirrhosis, brother's diabetes, abnormal liver tests, and hand arthritis were no longer disconnected facts. They were different expressions of an inherited disorder that had been accumulating silently for decades. Richard was referred to clinicians experienced in liver disease and iron overload. Further evaluation was used to assess the degree of liver injury and whether complications were already present. Treatment began with therapeutic phlebotomy. The procedure resembles donating blood. A measured amount of blood is removed on a schedule determined by iron levels, symptoms, and overall health. Because red blood cells contain iron, the body uses stored iron to replace the removed cells. Repeated sessions gradually lower excessive iron stores. An IDDK describes phlebotomy as the most direct and generally safe treatment for most people with hereditary hemochromatosis. Richard initially found the idea almost too simple. A genetic disease had been harming several organs, yet the main treatment involved removing blood. Over the following months, his ferritin level fell. His energy improved. The liver tests became less concerning, and his clinicians worked with him to manage diabetes risk and protect the liver. The joint pain did not disappear completely. That was the part Richard had not expected. Removing excess iron can prevent or reduce many complications, especially when treatment begins before irreversible organ injury. But established joint damage may persist. Waiting until the knuckles become severely damaged can mean that the clue leading to diagnosis is also one of the symptoms least likely to reverse fully. What stayed with Richard was not that arthritis had been a false diagnosis. He did have joint damage. What had been false was the assumption that age and physical work explained the entire story. Before I continue, let me ask you something important. Have you ever made a major decision while feeling worried, rushed, or unsure which information you could trust? That is how costly mistakes often begin. A frightening headline can influence your investments. Conflicting health advice can leave you confused. A convincing salesperson, online scam, or emotional family situation can pressure you into acting before you have checked the facts. And after 50, the consequences can be much greater. One poor decision may affect your retirement savings, your health, your independence, or your peace of mind for years. That is why I want you to take a look at the decision trap. It is a practical guide designed to help adults over 50 recognize fear, manipulation, hidden bias, misleading information, and high-pressure tactics before making an important decision. Inside, you will find a simple step-by-step system for slowing the situation down, checking the evidence, asking the right questions, comparing your options, and protecting yourself from mistakes that could become expensive. Do not wait until a bad decision teaches you the lesson the hard way. Click the link in the description and get your copy of the Decision Trap now. Then come straight back, because the next part gives you 4 specific details that can help separate ordinary arthritis from iron overload, hepatitis, autoimmune, liver disease, and other systemic causes that may be damaging more than the joints. There are 4 details worth noticing when joint pain develops after 60. The first is location. Which joints hurt? Ordinary age-related osteoarthritis frequently affects the knees, hips, spine, base of the thumb, and finger joints. Hemochromatosis-related arthropathy can involve the hands, including the knuckle region, as well as the knees and other joints. Location cannot diagnose iron overload, but an unusual pattern can give a rheumatologist a reason to look beyond routine wear and tear. The second detail is what occurs outside the joints. Unexplained fatigue, weakness, darkening or bronzing of the skin, diabetes, loss of sexual function, abnormal heart rhythm, discomfort in the upper right abdomen, or persistently abnormal liver tests can create a systemic pattern. Hemochromatosis can affect the liver, joints, pancreas, heart, and hormone-producing organs rather than remaining confined to one area. The third detail is family history. Ask whether a parent, sibling, or child has been diagnosed with hemochromatosis, unexplained iron overload, early cirrhosis, liver cancer, diabetes, heart failure, or severe hand arthritis. Family history does not prove that one genetic mutation is responsible, but because primary hemochromatosis is inherited, close relatives of an affected person may need testing. Early diagnosis allows treatment to begin before severe organ damage develops. The fourth detail is whether signs point toward another liver-related cause. Joint pain can occur with hepatitis C, autoimmune hepatitis, hepatitis B, and primary biliary cholangitis. These illnesses affect the joints through different immune, viral, and inflammatory mechanisms, not through the same iron overload process. Chronic hepatitis C is especially easy to miss because most infected people have few or no symptoms until liver complications appear. When symptoms do occur, they may include fatigue, joint pain, abdominal discomfort, nausea, dark urine, pale stools, or jaundice. The only way to know whether hepatitis C is present is through testing. Current CDC guidance recommends that all adults receive hepatitis C screening at least once, with repeat testing for people who continue to have relevant exposure risks. The initial test looks for hepatitis C antibodies. A positive antibody test must be followed by testing for viral RNA to determine whether an active infection is present. That matters because hepatitis C is now curable in more than 95% of cases with 8 to 12 weeks of oral direct-acting antiviral treatment. A person can spend decades believing fatigue and joint discomfort are unavoidable, while an infection capable of damaging the liver remains both hidden and treatable. The useful phrase at an appointment is not, "My joints hurt, so my liver must be failing." It is more specific. My joint pain involves these particular joints, and I also have abnormal liver tests, fatigue, diabetes, skin changes, or this family history. Could a systemic cause, such as iron overload, hepatitis, or autoimmune liver disease be contributing? And would liver tests, iron studies, or other targeted testing be appropriate? That sentence opens the investigation without forcing one answer. Depending on the full pattern, clinicians may consider a complete blood count, metabolic panel, liver enzymes, bilirubin, alkaline phosphatase, ferritin, transferrin saturation, inflammatory markers, hepatitis testing, autoimmune antibodies, imaging, or other studies. Not everyone with hand pain needs all of those tests. Testing should be guided by symptoms, examination, family history, medication use, alcohol exposure, metabolic risk, and previous laboratory results. It is equally important not to begin iron removal strategies on your own. Do not donate blood repeatedly because one ferritin result was elevated. Do not stop eating all iron-containing foods. Do not discontinue a prescribed iron supplement without understanding why it was given. High ferritin does not always mean excess iron. It can rise with inflammation, liver injury, infection, and metabolic disease. At the opposite extreme, a person with true iron deficiency anemia may be harmed by avoiding iron. Because they misunderstood joint pain as hemochromatosis, people with confirmed hemochromatosis are often advised to avoid iron supplements and high-dose vitamin C supplements, which can increase iron absorption. But ordinary dietary restriction is generally far less effective than medically supervised phlebotomy. Raw or undercooked shellfish may also pose a serious infection risk for people with significant iron overload or liver disease. Pain medication deserves caution as well. Acetaminophen, sold as Tylenol, and non-steroidal anti-inflammatory drugs such as ibuprofen and naproxen can be useful in appropriate patients. But liver disease, kidney disease, ulcers, blood thinners, and other medications can change what is safe. Someone with abnormal liver tests should not respond by continually increasing over-the-counter pain medicine without reviewing the total daily dose and medical history with a clinician. Certain warning signs should not wait for a routine rheumatology appointment. Yellowing of the eyes or skin, dark urine, very pale stools, a rapidly swelling abdomen, new confusion, vomiting blood, black tarry stool, or severe weakness can signal advanced liver disease or internal bleeding. Cirrhosis may remain silent early and produce these symptoms only after substantial damage has developed. A single joint that becomes suddenly red hot, severely swollen, and extremely painful may reflect gout, pseudogout, or an infected joint. Fever, chills, or inability to move the joint increases the urgency because septic arthritis can damage a joint quickly and spread infection through the body. The title says joint pain is not arthritis. In many people, it is arthritis. The more accurate warning is that arthritis describes what is happening in the joint, not necessarily why it began. Cartilage may be damaged because of age and mechanical stress. The immune system may be attacking joint and liver tissue. A virus may be triggering inflammation while silently injuring the liver, or excess iron may be accumulating in the knuckles at the same time it is accumulating in the liver, pancreas, and heart. Richard's hands were not a false alarm. They were the first organ loud enough to make someone investigate a disease that had been quietly entering the rest of his body for years. His liver had not screamed through pain. It had remained almost silent. The joints did the screaming for it. That is why persistent joint pain after 60 should not be judged only by how old the joint is or how hard it has worked. The most important clue may be the symptom that seems unrelated. The abnormal liver result, the darkened skin, the rising glucose, the unusual fatigue, or the family member whose cirrhosis never received a convincing explanation. Your aching knuckles may still come from decades of use. Your knees may still be showing ordinary osteoarthritis. But when joint pain arrives as one piece of a larger systemic pattern, another bottle of pain reliever may quiet the symptom while leaving the real disease untouched. The joint is where you feel the problem. The liver may be where the damage is quietly accumulating. Before you leave, understand what is really at risk. The cost of this guide is small, but the cost of one rushed financial decision, one misleading health claim, one convincing scam, or one panic-driven reaction can be far greater. It can cost you money you spent years saving. It can cost you confidence in your own judgment. And in some cases, it can cost you your independence and peace of mind. The decision trap was created to help you recognize pressure, fear, hidden bias, and misleading information before they influence an important decision. You may not need this guide every day, but on the day you face a decision that could affect your savings, health, or future, not having a clear system may become far more expensive than getting one today. Click the link in the description and get your copy of The Decision Trap now, because the best time to protect yourself from a costly mistake is before you make it.